Before I leave this earth, I want to help as many people as I humanly can within the capacity I can. There's got to be a better way of treating patients because we keep seeing the same problems. We're drilling, filling, and billing. So it's just never ending. What's happening is you're doing these extractions of these teeth that are not causing any problems and creating a problem. Biological medicine basically started back in Germany, and it's about looking at the terrain of the body. You can practice holistically, but you're not practicing biologically. You can practice biologically, you automatically are practicing holistically. If your immune system is robust, I don't care about what bugs are running around out there. There are emotions, traumas that we have that can actually affect the teeth. There's so much science behind the fact that mercury is toxic. Like I said, if you drop a mercury thermometer in a school, you have to evacuate the school and get hazmat in there to decontaminate. And here we are using it in patients' heads, inches from their brain. Fluoride, another neurotoxin. Why do some doctors not see that it is toxic? Well, they're indoctrinated. I will never refer to a peer-reviewed study. We are damaged, genetically damaged, generationally damaged because of the foods that we eat. They call us the alternative when actually the alternative is putting that crap, those chemicals, those poisons, those prescriptions in your body. That's the alternative.
Welcome to tonight's episode of The Health King's Court. I'm your host, Zach the Health King. A quick disclaimer to keep myself out of trouble. Anything that you hear in this podcast is not intended to be taken as medical advice. The thoughts and opinions you hear shared are just that, thoughts and opinions. And any action that you take based on what you hear is done at your own risk. And with that said, enjoy the show. Welcome everybody to today's episode of The Health King's Court, Ancient Wisdom, Modern Health. Today I have a very special guest that I'm really excited about. She is an international speaker and the Associate Director of the IABDM. That's the International Academy of Biological Dentistry and Medicine. She's a certified and accredited biological dental hygienist. Her company in Integrative Perio Solutions, LLC, she helps dental offices integrate biological or holistic dental protocols into their practices. Her passion is to dispel the misconceptions about holistic and biological dentistry and to introduce the concept to the allopathic world to make it the standard of care, not the alternative. That is a Francis Horning. Francis, welcome to the show. I'm very glad to have you here.
Oh, I am super excited. Thank you so much, Zakariya. I hope I don't overextend my welcome because I can tend to go off the rails a little bit because I feel so strongly about what you're doing and what we do in our world.
No, absolutely not. You have a lot of good stuff to say, as we've already established in our lengthy conversations before. Unfortunately, the viewers missed out on those, but luckily they're here to catch this one. So no, I will give you as much time as we have, and we'll see what comes of it. So let's just jump right into the nitty-gritty of it, because a lot of people might not even know what biological dentistry or holistic dentistry is. So can you give an overall definition, as deep as you'd like, on what those two terms are? Are they the same and synonymous? Are there some differences even in those two terms? What do those mean?
Okay. Actually, thank you for that, because that is, there's misconceptions in and of itself. And even amongst our practitioners, there's just sometimes disagreements on what the definitions are. I'm a bit of a purist. I come from I want to split hairs, and I come from a purist point of view. So I'm going to give you a little background of the history of the practice. Back in 1978, the Holistic Dental Association was formed. It was a couple of doctors that got together, and they're like, there's got to be a better way of treating patients because we keep seeing the same problems. Patients have decay, so we're drilling, filling, and billing. They come in with cavities, we fill them. We build them. They come with cavities. We build them again. So it's just never ending. And, periodontology. So the patients are constantly, they feel like they were just, plugging the hole, like, the little finger in the dike kind of a thing. So there's got to be another way of treating it. So they started looking at other ways, and they found that addressing disease in a holistic manner, meaning mind, body, spirit, is certainly a way of opening horizons on how patients can be treated. To give you an example, things like dental decoding. There are emotions that, or traumas that we have that can actually affect the teeth and cause decay or periodontal disease in certain sections of the mouth, and depending on what those traumas are that we're holding on are, even with meridians, et cetera. So treating somebody with holistically, meaning as a whole, it's not just a symptom approach. Like the doctor said, I'm not going to just fill a tooth. I want to see what's causing it, and it can be these other factors. So I want to treat the patient that way. So that started back in 1978. Moving forward, in 1984, the International Academy of Oral Medicine and Toxicology was formed. What this was is about 11 doctors, a physician, dentist, a physician, and a lawyer. They were all happened to be at a conference on the toxicity of mercury. And they were talking about mercury toxicity. We know that, mercury in the wastewater, mercury, you drop a thermometer in a school, you have to evacuate the school and, get hazmat in there. But they were like, it's amazing how deadly it's such a neurotoxin. And they talk about the toxicity and the neurotoxicity effects of it. And we as dentists, we're putting in patients' heads literally inches from their brain. Like, there's got to be an issue. So they tried to find the research to show the toxic effects of mercury, and there was none. There was nothing. So the IAOMT was formed because they said, show me the science. That's their moniker. Show me the science. We were going to try to find and do our own research to show the ill effects of the use of mercury, whether it be for dental reasons or in the environment, because even if you have a mercury filling and it's drilled out, it can go into the wastewater. So we're looking at ecologically, environmentally, and also dentally. And then with drilling them out, how is that affecting the patient? And never mind just the patient. What about the doctor that's drilling it out? Because he's seeing patients all day long, all week, all month, years. And they're constantly being exposed to mercury toxicity. So the IOMT was formed to study that. And they've now also a strong opponent, of the use of fluoride, another neurotoxin. And while this was all going on, there was a couple of doctors there were colleagues that they wound up at a lot of the same conferences. And these two doctors, namely Dr. Ed Arana and Dr. Gary Virigan, they wound up at a biological medical conference up in Canada. And at that medical conference, they looked at each other and like, the concept is so mind-blowing. Why are we not doing this in dentistry? Makes no sense that we don't do this in dentistry. Biological medicine basically started back in Germany. And it's about looking at the terrain of the body. Looking at toxic burden. Actually, there's 4 pillars of health. Your methylation pathways, detoxification pathways, if there's any disruption in those, cellular regeneration, also micronutrient deficiencies, and also autonomic nervous system issues. So if there's any dysregulation in any of those pillars of health, it's going to affect the terrain of the body, and the body's normal state of health is in health. Like the body wants to be in health. So if there's any deviation from that, that's when you're going to have symptoms of disease. So like the concept is so straightforward and so it makes so much sense. Why are we not doing this in dentistry? So they got the physicians from Germany to come here to the United States, brought their books in German, had them translated into English, and they extrapolated information out of that pertaining to dentistry. So that's why at the end, when all that information was extrapolated and aggregate put together, they were like, okay, great, we have all this information. What do we call it now? So the doctor from Germany. He's like, it's based on biological medicine. Let's call it biological dentistry. And we're like, oh, that's brilliant. Of course, that makes the most sense. So that's when in 1985, the International Academy of Biological Dentistry and Medicine was formed. So that was a big, long explanation, but I'm going to boil it down. You can practice holistically, but you're not practicing biologically. You can practice biologically, you automatically are practicing holistically. You're practicing holistically, meaning you're looking at the whole body, but you're using less toxic materials. You're not using mercury. You're safely removing mercury. You're not using fluoride. You're looking at the mind, body, spirit of the patient. But are you addressing the terrain of the patient? If you're not addressing the terrain of the patient, you're not practicing biologically. So sometimes people will call themselves a biological dentist or a biological dental hygienist, but they are not treating the patient biologically. So as a purist, I want to make sure that you're practicing biologically, i.e. addressing the terrain of the body, not just using non-toxic materials.
Perfect. Thank you for that explanation. I think anyone that's at all familiar with the terms that you use will absolutely understand where the assorted terms fall into the spectrum. And yes, you surmised it greatly with holistic dentistry might be a more umbrella term, and then biological dentistry is a very specific, more strict kind of things that are practiced. And in relation to terrain theory specifically versus germ theory, whereas a general holistic dentist practitioner might not even understand what terrain theory is. And that's a very interesting conversation that I don't know if it's for today, but I certainly advocate for anyone to look into terrain theory versus germ theory. And I have discussed it, I think, on a couple podcast episodes as well, in that terrain theory I see it as a platform that is empowering versus germ theory is a platform that is, one, disempowering, but two, a lot less logical when you really start to look into it. So that's an interesting field of study, because most of our medical practices are built upon germ theory. And if germ theory is not valid or not correct or not, the right way to go or a correct framework, then how can anything built upon that be correct either?
I'm going to jump in, if you don't mind. I'm going to take 2 minutes of your time, and I'm going to talk specifically about that because that's one of my passions. I am not extremely learned in the topic, but enough to take a stance on it. And I literally just had this presentation this morning to a bunch of conventional dental practitioners, and enforcing that fact that germ theory versus terrain theory, because you can have a patient who or person who gets pathogens for whatever reason. I'll give you an example. I'm going to have a party next weekend, hypothetically. And my cousin Susie, she loves my pepperoni bread. So she's going to come no matter what. She comes and she's sick as a dog, coughing and sneezing and sick. She's very sick. And now I got a room full of people. Now, of those people, you can have a couple get just as sick as Susie, or you can have a couple that barely get a snivel. One will wind up in the hospital, and then a couple won't get sick at all. Why? They're all exposed to the same germ, but what kept them from getting certain levels of illness or lack thereof? It's their immune system, the terrain of their body. If you are healthy, and if your immune system is robust, I don't care about what bugs are running around out there. And again, that's a whole nother conversation. The past couple of years, we've been having issues with that, which I don't want to get into right now because we're going to talk about dentals. Okay. So that being said, addressing how my body responds to the germs, because the germs are there and you need it for homeostasis, because it's not unusual for the body to have good and bad, because you need to have homeostasis. So as far as I'm concerned, yeah, you want to be concerned about the germs, you want to overexpose yourself, but I'm more concerned about the terrain and how do we support the terrain of the body. And that is how you're going to fight any of the pathogenic potential of these germs. So I'm sorry, I just felt the need to put my 3 cents in there.
No, no apologies needed because it sets the foundation for the conversation that we're having for
Exactly.
people that have not been exposed to schools of thought like we are going to be talking about. Because if you don't understand the foundation and all of that, how can you really ever kind of comprehend where all those puzzle pieces of the bits of information get put together? So thank you for the explanation. So let's get into some nitty gritty because we already talked about a couple interesting details in the dentistry world and a couple controversial things in the dentistry world. One of the first things that you mentioned was mercury. Let's dive into that. One, why did they even start saying let's put mercury in teeth to begin with? Why was that introduced? And why is there still some people that are so hell bent on that it is the way to go? Because I've seen dentists, even in 2024, really strongly defend the
And they
use
get
of
angry.
mercury, whereas more and more dentists right now also are saying, wow, this is actually a gigantic deal. And then there's people in the spectrum all along. So where did that come from? Where did that practice come from? And
Okay.
why is it still going on today?
I'm glad you asked. Back in, I think, the 1850s, there was a couple of brothers from France that found this filling material would be great to help people who have decay. Because before that, only anybody who had cavities or decay, they could only do one or two things: extract the tooth, or if you were rich enough, if you were an aristocrat, you could get a gold filling. Now, most of us could not afford to have gold fillings, so our teeth rotted and they were extracted. So with the advent of this new filling material that was found in France, the brothers brought it over here and they're like, oh, this is a new material. It's like more cost effective. We can help more patients. It's an amazing thing we're going to use. And at the time, there was an organization called the American Academy of Oral Dental Surgeons, excuse me, the American Academy of Dental Surgeons. And they kind of like oversaw the practice of dentistry. Now, most dentists, quote unquote dentists, were barbers, right? So you get a haircut and get your tooth pulled same time.
Really?
So yeah, they were barbers. So they formed this group, American Board of Dental Surgeons, and they were like, okay, we can introduce the use of this amalgam because maybe we can help more people. It's more cost effective and blah blah blah. As time went on, during the same time, it was very popular for men to wear hats, wear their tall hats. And what was happening is these manufacturers of hats, you have these hatters. And what they would do is they would have to take animal felt and they would, animal pelts rather, and they would take mercury and they would rub the pelts to make the felt to make the hats. Now, there was no air circulation, there was no fans, there was nothing like that. You're lucky if you had a window. So what was happening is these hatters were getting exposed to the mercury vapors and they literally were going mad hatter. A lot of people think it's just a story in a fairy tale. So these matters were going mad. They had suicidal ideations. They became very shy and very reserved, and they started having tremors, and they literally were going mad. So the American Board of Dental Surgeons were like, "Oh, wait a minute, this is not good. We're seeing these hatters are starting to have, neurological conditions, and they're using the mercury now. The mercury is in the amalgam, so we don't want to use them anymore. We don't think it's a good idea. So we're actually going to have a decree written up and that you need to sign this contract to be part of the Board of Dental Surgeons. You need to sign this that you will not use amalgam fillings. And if you do, you're a quack." Now, how you like that for an irony? If you use amalgam fillings, you're a quack. You have to sign this. Well, there was infighting amongst all the members because they're like, you have one faction say, oh my, What do you mean? We're helping so many people, and it's easy to use, and this and that. You're crazy. There's nothing wrong with it. And then he had the other faction that believed that it was not good. There was so much infighting that the organization disbanded. What happened is the people that were for the use of mercury fillings rebanded together, became very strong, and years later they became, what organization do you think? The ADA, the American Dental Association, which is on every tube of toothpaste, and it's like the standard of care that has the ADA seal of approval. Now, don't get me wrong, I am actually a member of the ADHA. The reason being is I want to be able to introduce what we do into their world again. Not because I believe in that, it's because I want to reintroduce what we believe in to those practitioners. That's why I did my webinar this morning to those conventional practitioners, because it started off as if when you are using amalgam, you're a quack. But now, if you are a proponent of removing, mercury and talking about mercury toxicity, now all of a sudden we're quacks. They're a bunch of kooks and witch doctors. They don't shave their legs, then they smell like patchouli. They're a bunch of nuts. But no, it's evidence. There's so much science behind the fact that mercury is toxic. Like I said, if you drop a mercury thermometer in a school, you have to evacuate the school and get hazmat in there to decontaminate. And here we are using it in patients' heads. So when the IABDM was formed back in '84, they have been doing a lot of research and more studies, and you can find a plethora of studies online showing that mercury toxicity exists. Why do some doctors not see that it is toxic? Well, they're indoctrinated in the fact that when you're in school, you're taught to use amalgams. The amalgams are safe. The ADA says amalgams are safe. So of course, they're going to say that, because look what they did back in the 1800s. That it's safe, there's nothing wrong with it, and it's going to not harm anybody. A few years ago, the FDA, which again is another organization which, can be potentially questionable. I'm trying to be safe here, okay? All right, Zach, I'm trying to be safe. So they put out a statement that not everybody should have amalgam fillings. The FDA put out a statement that women of childbearing age should never have an amalgam filling. Women who are breastfeeding, people who have pre-existing kidney problems or pre-existing neurological conditions should not have amalgams, because it can potentially cause problems in these people. And especially number one is any children should not have an amalgam filling, especially any child under the age of 6. Now, unfortunately, when you go to a lot of the pediatric offices, and then sometimes I hate to say some of the Medicaid offices, that's all they use. That's all they use. So we're putting this toxic material in mouths of bodies that are forming. It's the most formative years, and it potentially can harm them long term. Now, what I said, well, I've had a mouthful of fillings for my whole life, and I've never had a problem. Wonderful. God bless you. You can methylate, meaning your body can process the toxins and get rid of them. What if you're a non-excreter, like yourself, being a man? A lot of men are non-excreters, and it could be a woman also. What it means is the body hoards the toxins. So I can have an amalgam filling and it off gases. So it's constantly off gassing every time you chew, every time you brush, if you chew gum, if you drink something hot, it's off gassing constantly. So you have an accumulation of mercury in the body. And if your body cannot get rid of it through sweat, urine, feces, any of those methylation pathways, it just stays in the body and it accumulates in, the liver, kidney, the brains, and it can affect you. And then, over time, you can start having physical symptoms. I mean, you can have a mouthful of fillings done when you were like 13, 14, and then maybe in your 40s, now all of a sudden you're starting to get the Parkinsonian shakes, or I have brain fog. I can't concentrate on the page I'm reading. And you have no, and then you go to the doctor and they're starting to give you meds for the Parkinson's, but they don't look at the fact that maybe it's potentially mercury toxicity. It's causing these symptoms. And because it's so far apart, you can't realize. So a lot of times when some conventional practitioners, going back to that statement, they're so indoctrinated in that mercury amalgam fillings are safe, they long-term, they have long-term predictability, and that you're crazy to say there's anything wrong. Some patients it may not affect. Very small portion.
There's a lot of points there. It's really funny to me, as in addition to being sad, how so much of the people on the side of so-called science are just dumb nerds. They're really just dumb nerds, to put it plainly. They'll just get so, like you said, indoctrinated into what their nerd overlords are telling them to do, and have complete and utter and everlasting blind spots to actual science that is contrary to what their overlords tell them.
And they cherry pick the science that they want to believe in too.
Yeah, exactly. Not ever, of course, recognizing either that a lot of science is bought and paid for. It's ridiculous.
I will never refer to a peer-reviewed study.
Yeah, exactly. And people who are so like dead set, oh, show me the study, show me the study. You're just a nerd. You're a dumb nerd. What do you have to have a peer-reviewed study to believe anything? There's people out there that won't say the grass is green unless there's a study on it. It's
Thank you for that. Right?
You're just a nerd. It's really, we need to bring that term back. It's the only actual thing to say about it. And obviously there are good nerds too. There's nerds that are super smart people and have their wits about them too. I'm not dissing.
Yeah, no, I get it. Scientific. I like to think I'm a good witch, not the bad witch. So I'm the good nerd, not the bad nerd.
Exactly. But there's so many things I want to even address in that your soliloquy right there before we go any farther.
Yeah.
Because you mentioned something about people I have mercury fillings and I'm fine. Are you though? You've addressed the point that yes, some people might handle certain things better than others, but there's so many people. I hate the phrase, I did X and Y and Z, or my parents did X and Y and Z, and I'm fine. Meanwhile, I have chronic pain and inflammation, and I can't sleep well, and my chest hurts sometimes. Are you fine because you're alive and you haven't actually just died yet? Or are you facing a series of issues that you're just unaware of and unconscious of because you have no self-awareness and understanding of how a body is meant to work? I hate that phrase, I'm fine. But yes, you touched upon that certain people's bodies may handle things better than others. But let's even go into that. Because in the warnings, like in amalgam fillings, that they give, people who are young, people who are sickly already, people who are this, that, the other, who are more sensitive shouldn't do this. What they are essentially recognizing is it is bad, period, for everybody, but it will specifically show symptoms more likely in these people. There's you think it picks those people to be bad in? No, it's just those people that it's specifically more likely to show it in. But like you said, that's going to build up in anybody over time.
Yes.
Over time, and it releases over time.
Yes.
But you said something I want to ask. But actually, before I do, let's back up for the viewer's sake and the listener's sake.
Sure.
Because I'm familiar with amalgam as a term and as a phrase, but we seem to be using it a bit synonymously or interchangeably with mercury. Can you give a quick definition of what that is? Because people might be confused. We amalgam, mercury. Well, what?
Absolutely. Yeah. Sorry. You're absolutely right. Thank you for that. So when I say amalgam, those are the silver fillings that you see in your mouth. Maybe not yourself, but like if somebody has like a silver filling or a black filling, because what happens is the silver in the filling will tend to tarnish over time. So an amalgam is basically if you look at the word amalgamation, it's taking several things and putting it together. All right. So an amalgam filling is that silver filling. And that's even a misnomer because a amalgam filling is that metal. It's different types of metals. It is basically 50% mercury with other metal ions in it. So basically, more than 50% or more than half of that filling is mercury. And then you have silver and nickel, and you have other stuff in there. So when you mix the liquid mercury with the powder, the metal powder, that's what you create an amalgam. But in actuality, that silver is coming from the silver color is coming from the amalgam. I mean, Jesus, it's the mercury. So when I say mercury and amalgam, I'm always referring to mercury. And so when I say amalgam, so that's the name of the filling, but it's 50% mercury. So when you're drilling out an amalgam or that filling, you're releasing that mercury into the air, into the environment, into the patient. They're breathing it in, the doctor's breathing it in, the assistant's breathing it in. So it is not healthy. So mercury is a component of an amalgam, a big component of it.
Thank you. Thank you for that clarification. And I always like actionables. I like to approach health and health topics, even the scary ones, from a standpoint of, well, what can we do about it? Because there may be people listening to a conversation such as this and now be fearful. Oh my God, what do I do? What can I do? So if someone is listening to this conversation and looks in the mirror and they see silver fillings in their mouth, what do they need to do? Do they run to their nearest dentist and get it? Oh my God, can you remove this? What can they do and why?
I'm not here to tell anybody what they can and cannot do. I can only recommend what they should do.
Fair enough.
So, okay. So, because I don't want to, well, Fran said.
What would Fran do if Fran had?
What Fran would do is I would highly beg you to find a holistic or biological dentist. The reason being is if you have a regular dentist that you're already seeing and you say, I want my silver fillings out, they're going to do one of two things. They're going to say, nope, there's nothing wrong with them. I'm not taking them out. You're wrong. There's absolutely nothing wrong with them. I see no need to remove them. Or they will take them out, but they're not going to use any kind of precautions. Because like I said, when you are removing a silver filling, amalgam or mercury filling, take your pick of what you want to call it. When you're drilling that out, you're aerolizing all that mercury into the air and you're breathing it in, you're swallowing it because they're not using any kind of precaution. So amalgams can be, pieces of amalgam can be in the back of your throat and you're swallowing that. And what happens is you swallow a piece of that amalgam or you're breathing in subparticulate pieces of amalgam because it's aerolized. Those pieces of amalgam never leave, right? So if I breathe in a subparticulate piece of amalgam, it's got mercury in it. So what's going to happen is the mercury is going to continue to off-gas in my lungs. Or that amalgam that I've swallowed, now the mercury is going to disperse through my intestinal wall and my stomach lining. It can go into the bloodstream. So what's happening is there's no precautions taken. You can increase your exposure to mercury. Now, if you even possibly mercury toxic that you may not even be aware of, you could have symptoms. People can have symptoms of something as simple as like just a rash. They can have like rashes, or they even have like some tremors, or if they have any kind of brain fog, or some people have gone to their integrative doctor or functional medicine or nutritionist, naturopath, and they found out to be mercury toxic because they've had so many physical symptoms, joint pains or whatever, and they're found to be mercury toxic. And then you're like, okay, I need my amalgams out because the doctor can't chelate or pull the mercury out of your system as long as you still have the mercury fillings because it can continue to off gas. So you say, okay, I'm going to go get my amalgam filling. I'm going to go to my dentist. And then he's going to remove them without precautions. Now he's increasing even more your exposure. So if you're going to consider removing your amalgam fillings, I'm not here to arbitrarily say everybody has to have them ripped out. Everybody's individual situation is different. if you are going to do it with a holistic or biological practitioner. And the couple of organizations where you can find them. So, the IABDM.org or IAUMT.org, you'll be able to find dentists that are like real practitioners. Not some people who are charlatans. I'm sorry, they will call themselves holistic and they don't do anything holistic except maybe burn some, incense or have some essential oils in the office. And, it's a ploy, and they give you a hot towel and they have spa music playing. No, that's not a true biological or holistic practitioner. So go to the sources like IUMT.org or IABDM.org, because those are the people that are been trained on how to remove it properly to protect you from more exposure. And they usually will also work with practitioners that will help you chelate if chelation is necessary, because dentists can't do that because that's beyond the scope of licensure. So that's
Yeah. And
whole.
I could certainly attest to the differences there because I've experienced it in my personal life. When I first learned about the dangers of mercury and the importance of getting it removed, I went to the dentist that I just knew of and was local to me. And they reluctantly did it. They like had to, it was like pulling teeth to even get them to do it. And they take zero precautions. They basically just, okay. And honestly, their attitude towards the whole thing makes me suspicious of if they even removed it all, because they didn't really give a shit, is really what it comes down to.
Exactly.
So I certainly don't recommend anyone go to that particular office. I'm not going to say it here, but if anyone wants any suggestions on where to avoid in Monroe Township, I don't think it was quite Quarter Acre Road, but I don't know, something like that. Don't go there. Same office. Actually, I know someone that visited and specifically asked them to use the fluoride free, whatever, that they were doing. And they actually used the fluoride stuff. And then the person, while it was in their mouths, wait, this doesn't taste right. This actually tastes very chemically. And then they're like, oh yeah, actually I used it because it's not yeah, that's basically biological assault. So I certainly don't recommend going on the to that dentist that's in Monroe Township, New Jersey. And like I said, it wasn't quite Quarter Acre Road, maybe 3/4 acre road, somewhere in between. I don't know. But I've seen some very negative experiences there and have a personal experience. Not so fantastic with that. They did offer a free cleaning afterwards to that person for that case of biological assault. So, oh well. But when I did learn better and learn of a better option, I did attend, and I'm sure they wouldn't mind me mentioning, and if you do think I would, I did attend Dr. Gershinsky's Holistic Dental Center in Millburn, New Jersey. Had a fantastic experience. I highly recommend that office. They treated us with the utmost of respect, the utmost of information, and to see the way that they approached the process of removing an amalgam filling and replacing it with a safer alternative, it was beautiful. They masked off the individual tooth so that nothing could get anywhere else, even within the mouth. And then they had a giant vacuum pulling any gases off. They were in like hazmat suits themselves, and it was they took it very seriously. It was wonderful to see. Certainly made me frustrated at my experience that I had at the other place. But yeah, so I got to see the difference in how someone that takes it seriously and understands the importance of such a thing behaves versus people who are just doing it because.
Right.
But that brings me to a question of cavities in general, because I've seen different schools of thought on how to approach a cavity. One, we were talking about obviously filling it with a safer alternative. But I've seen schools of thought that cavities should not be filled with anything external, but should actually be promoted to heal. And there's certain things you could do to have a tooth regenerate, be like any other tissue in the body, and actually heal from within. And some people think that that's crazy. There's no possible way that that could happen, as if a tooth is just a dead thing in your body. There's a couple questions in there, right? What is the alternative that gets used to fill a cavity?
Okay.
And why is there drawbacks to that? Is that entirely safe? Or should a cavity be approached in a let's heal it from within standpoint?
Okay. Thank you for that, because there's a lot to unpack there. It really depends. Okay. Okay, we're going to start with the first question first. If you're not going to use amalgam, you're not going to use the mercury filling, what are you going to use? Biological or holistic offices, they're going to use either a ceramic, which is zirconia filling, or they're going to use what's called a composite. But the composite was almost like a plastic material, which is like a white filling. It's going to match the color of your tooth. But they are only going to use filling material that is BPA free, BCMA free, and no fluoride in it. Because once, especially if somebody is coming in for an amalgam removal, you can't leave an open hole because the patient is going to be in significant discomfort. So you have to replace it with something. So you put in that composite filling, but a holistic biological practice is going to no BPA, no BCMA, no fluoride. We're going to make sure that we're going to use, or they would use a ceramic filling. What if, so when you say about healing, yes, I believe in arresting and reversing decay. Absolutely. But because teeth are crystalline structures, you can't, once it gets past a certain point, you can't get it to regenerate itself. You can get it to slow down, but you're never going to be able to reverse it. Depending on how deep and how far the decay is in the tooth, absolutely 100%. Let's not fill it. One office will fill it, and somewhere like us, we're no, we're gonna ozonate it. We're gonna have you use something like a hydroxyapatite. Hydroxyapatite is actually a material that's found naturally in our teeth and in our bones. It's the most biologically compatible material that you can have, that it's shown to be as effective, and I hate to say that it's effective as fluoride, because fluoride is crap. But the standard of care, the fluoride remineralizes. Well, it's a byproduct of aluminum. It's garbage. But the studies show that it's effective in reversing decay. Well, hydroxyapatite is as effective, if not more so. And it is a material that the body produces. So if I have a cavity in a tooth, and if it's not super deep, I can get ozone, medical grade ozone, which kills. Medical grade ozone is made from oxygen. Nobody can be allergic to oxygen. If you're from another planet, if you can't take oxygen, okay? So ozone is just supercharged oxygen, and what it does is it kills anything that does not have an antioxidant on it, and that's bacteria, viruses, fungi, and parasites. So what they found causes tooth decay is this particular bacteria called Streptococcus mutans. So the Streptococcus mutans is there, and there's a cavity. If I treat the cause, so if I can do one of two things. I can fill the cavity, that's treating the symptom, or I treat the cause. I can use ozone, which will kill the bacteria that is there, that is creating the cavity. And then it helps remineralize the tooth. And then using the hydroxyapatite on top of that, I can get remineralization and reversal of decay in those areas. Once the cavity gets deep into the dentin, which is the inner part of the tooth, which is much softer, just think about it like an M&M. The M&M, which none of it, that's garbage food, but it's the best analogy I can think of. Got the hard outer coating and then the softer inside, right? So think about what you see if you look in the mouth and you look at your teeth, you're looking at the enamel, which is the outer coating of your tooth. That's like the hard shell, right? And then inside the tooth is like the chocolate inside the M&M. That's the dentin, which is much softer. It's not as hard as the enamel. So once the decay gets through the really super hard part of the tooth, if it gets in deeper into that softer part, it's just going to it's going to get much bigger, much faster. So by that time, it's going to be hard to reverse it. So that's why when we catch decay, we want to catch it where it still can be arrested and reversed. Things like using oil pulling, coconut oil pulling. also is an amazing thing because it kills strep mutans. It's got lauric acid in it and caprylic acid in it. So you're going to get some reversal of tooth decay by doing something like that at home. Still should floss. You still should brush. Also, if you're vitamin D deficient, if you have any kind of vitamin D deficiency, unfortunately, a lot of people think their vitamin D is fine. I went to the doctor and it's like 35, 40. It's good. People should be like 70 or 80. And if you have any other medical conditions, it should be close to 100. So a lot of people, unfortunately, they get their vitamin D checked and they're like 9, 11, 13. It's really super low. So making sure your vitamin D level is good. Using ozone. You can actually have, there are new machines that you can use ozone at home, ozonated water. You can make ozone water irrigations for yourself at home, using the hydroxyapatite toothpaste at home. There's hydroxyapatite powders that the offices use, but hydroxyapatite toothpaste at home, like Risewell, Boca, there's several different types. And there's another one called Dr. Jen's, which has 10% hydroxyapatite. The other ones have 3. So the more hydroxyapatite, better off you're going to have resolution. So these are things that you can certainly do. I know there are some people that believe that you don't need to fill teeth at all. I'm going to, from a practitioner point of view, the last thing we want to do is interfere with the body. As a biological practitioner, I do not want to be invasive. Absolutely not. But then it's a catch-22. If there's deep decay that is going to affect the nerve, infect the nerve, not just affect the nerve, it's going to infect the nerve. And then what's going to happen is those pathogens are going to get into my bloodstream. So what is the lesser of the two evils? Do I address decay that I feel is going to exacerbate very quickly? I want to keep them out of having a bigger problem. And I'm going to have to do minimally invasive treatment on that tooth, or not address it and then, keep my fingers crossed and pray that nothing gets worse. Because once it starts to affect and infect the root of the tooth or the canals of the tooth, then you get root canals. That's another set of big issues.
Yeah. Yeah, there's so much to dive into here. Let's back up a little bit and even
Sure.
still talk about the ceramic fillings, right? Because I imagine, is all ceramic fillings going to be BPA free, or is there a range of them?
No, we like the zirconia oxide, because that is shown to be the most compatible if you're going to have any kind of porcelain. And it's the cleanest one.
Would I be able to tell retroactively, or would someone be able to tell retroactively what that office put in my mouth, or am I just?
Sometimes they'll have a record of what they do. Like there's an office that I know that you know of also, that I know they use a particular lab. They use a particular material that is purely zirconium.
Yeah.
That I know for.
But only that office, like you wouldn't, someone wouldn't be able to take an X-ray and or see the composition or anything.
No, unfortunately, no.
Yeah.
But most of the time, a biological or holistic practice is going to use a compatible material.
Yeah.
If they're worth their weight in salt. Now, that being said, not all people can have zirconia either.
Really?
There's something called reactivity, because you have an allergy and you can have a reactivity. So if I have a patient that comes to a practice and they have a medical history where they have a propensity to have allergic reactions, or they're reactive to, I can't have this because I swell, or I can't have that because I break out in a rash, or we're going to do what's called reactivity testing on those patients, where we do a blood test, we do a blood draw. Because a lot of these biological practices, we have people in there that are phlebotomists also, like an assistant or a hygienist or a doctor. They can actually draw blood. And that blood is sent to a lab. There's a couple of different companies, Clifford Testing, Biocomp. where they actually do an assay where they see, okay, they take the blood sample and they do an assay and they see if it reacts with any of these materials. Like, for example, Clifford testing, I think, is over 17,000 different dental materials. Who knew there was 17,000 dental materials out there? A lot. So they test it against all the materials and see if there's any immune response, meaning the IgE response in the blood. And then a report will come back and say, patient cannot have X, Y, Z, or patient's clear they can have any material they want, or avoid, they're highly reactive to ABC, they're moderately reactive to X, Y, Z, and they're not reactive at all to anything else. So depending on the person, depending on how they present, they can actually be tested prior to any filling material is ever used to see what they can and cannot have.
Wow.
That's really practicing biological dentistry, because we don't want to just say, well, this is what our standard of care is, and we're just going to cram it in your head and, hope for the best. Or are we proactive and make sure that anything that we use is compatible with the body?
That's beautiful. I really hope that opens up people's eyes to see what quality care actually looks like, because it really does highlight how much of a joke the standard of care is in most fields. And so I guess one last question on cavities. I got two more that I want to cover. You mentioned bacteria eating away at a tooth and causing cavities. Is that always the case? Is it bacteria that cause cavities, or do they exacerbate it? Is it a lack of minerals that cause cavities, or is it both? What is the causation of cavities? Everyone said sugar. Why does sugar cause it?
Yep, the combo platter.
Yeah.
Answer to that. So depending on each patient, see, this is where in allopathic medicine or allopathic or conventional dentistry, everything is, this is the playbook. Patient presents with a cavity. That means they're not brushing and they have, strep mutans, and they're eating a lot of crap. They're eating shit, they're eating sugar, they're eating carbohydrate, and that's what's causing the decay. But in a biological world, we're going to look at, okay, there's decay here. Is it because it's the presence of strep mutans? Is it a combination of the fact that that person was inoculated as an infant by their mom? Because when a child is born, the mouth is sterile. And what happens is when a child is birthed, the baby basically takes on some of the mother's microbiome as it goes through the birth canal. And then when they're, here on Earth, then, the mom, obviously, usually for the one, is taking care of the kids. So their microbiome is introduced to that child. So if I have a mom who has a mouthful of fillings and a mouthful of decay, and she's constantly getting decay all the time, potentially she has strep mutans, and now she's going to inoculate the baby with that. So now that child is going to have that problem moving forward. It could be that, or is it, like I said earlier, if there are any micronutrient deficiencies, primarily vitamin D. If a child is D deficient, that increases their risk of tooth decay. Also, I mentioned briefly, which I'm not going to talk a lot about today because I'm not learning enough in it. And actually, I'm going to a conference to learn more about it because I think it's fascinating. Dental decoding, where emotional traumas can actually affect teeth. Like you can have decay in certain teeth, not other teeth, but just certain teeth that can be correlated to trauma or unresolved emotional issues that you have with certain things. For example, you can have an unresolved mother issue, and that actually can affect certain teeth depending on what that issue is. Same thing with father. I know I'm going a little bit far out there, but honestly, this is like a holistic approach, because if I have a patient that every time I see them, I'm drilling and filling those teeth and I'm still not getting any resolution, there could be another component, an energetic component to it, whether it be emotional trauma or meridian. It could be meridian issues. There's tooth organ meridians. So you can have a systemic issue with one of the organs that's energetically connected to a tooth, and that issue can affect that tooth and vice versa. So there's a lot of different things that can be. I don't believe in, oh, it's only the bacteria and only that you're eating sugar. That could be part of it. It could be many of the other things too.
Oh, absolutely. And it's such a shame that it just gets told on the person, especially when that person is a child. Oh, you're not brushing good. You're not brushing good.
And
You know
that
what? I got
now,
told that as a kid, and then
yeah,
I actually went on to start over brushing and ended up wearing away some of my gums because nobody tells you, hey, you could overbrush too. You just go,
exactly.
oh yeah, you got to brush, you got to brush, you got to brush. But no, I'm certainly don't mind having that mentioned in regards to the emotional connections to individual teeth because it's absolutely essential. And you touched
Yeah,
on it
absolutely.
in a very good introductory way in that, yes, there are energetic centers of our body, whether it is the organs or whether it is the teeth, because there is also connections between certain organs and certain teeth. So if you comprehend that, yes, certain emotions can tuck away in certain areas of the body, and that has been scientifically studied as well. That's why we do touch upon it in the beatcancer.org cancer course, because that's a very big part of what we talk about. Because if
Yep.
you have an issue with something specific like your mother or father, parental issues, or the other way, if you have trouble with your children, if you have financial stress, those actually have been scientifically studied to correlate with cancer in certain organs.
hundred
And
percent.
so when we know there are the meridian lines, like you touched on, that might be a new term for people, that but basically the meridian lines are the energetic pathways, and they are represented by physical pathways as well, such as lymph node paths or nervous system paths, etc. When there is a problem in one area, whether it started in a tooth or started in the organ or started emotionally,
Which is going to affect that
it's
meridian.
gonna go all the directions. So it could have started emotionally, then went to the organ, then went to the tooth. It could have started in the organ, then it messes you up emotionally, then it messes up your tooth.
It's a
That's
cycle.
what holistic approaches to health are all about. Figuring out not just, hey, this is the symptom that's presenting, but where's the origination of it? And then how do I make sure that all areas that are connected to that presentation of a symptom or that root cause, how do I kind of heal all fronts and make sure that none of them are still lagging behind and having damage?
100%. Here in America, we're all about symptom treatment. We treat the symptom. You have a
Yeah.
problem, we treat the problem.
And
We
treat is
don't
even a
look at
strong
the
word there.
cause.
Treat is even a strong word there. We mask. It's a masking
Exactly.
symptoms.
Exactly.
It's a stacking of band-aids until,
Right.
it all
Address the
tumbling down.
cause. If you address the cause, then guess what? It's not going to happen again. And you're not going to be retreating.
What do you
Um,
think? And the reason why it is done, and we could go into orthodontics and the harm there versus orthotropics, but specifically in this, it sparked my thought. What do you think is the harm, if any, of all the extraneous and unnecessary wisdom teeth pulling
oh,
that gets done? Because the
um,
wisdom teeth, if I recall correctly, are connected to the heart center. And what do you
yes.
think is happening when all these people are running around with potential damage or pathway of infection or
Well,
something missing that's
ex-
supposed to be connected to their heart?
exactly. Well, what I find most concerning about uh, most third molar extractions, wisdom teeth, third molars, a lot of times that's done during the time of, late teens, early 20s. It's usually done when you're in high school or you're in college or whatever. And the reason why I say that is there's a reason. During that time, stereotypically, we don't take care of ourselves. We don't sleep. We're out all night. We're up all night. We're watching, playing games or whatever. And our diet is not that great, during the time of that age group. And so what happens is they go and have these third molars extracted. Oh, you have to have them. extracted because it's could potentially cause a problem. There's no infection there now, but it could potentially cause a problem, and we want to be proactive and all that. So what happens is now you extract these teeth, and you don't do it biologically. Okay, you just go into a regular surgeon, and you get them yanked out. So what happens is now you're asking, again, terrain theory, you're asking the body to heal correctly, because you now need a blood clot to fill that in so that you can have bone fill and get proper healing. Now, what's happening? We just said somebody who's in their late teens, early 20s, they're not sleeping, right? They're eating crap. They're eating McDonald's and Burger King and God knows, what they're doing. And their body, the terrain of their body is a hot mess. It's just crap. So you're going to ask the body to heal. So what happens most times, these third molar extractions, they turn in what's called cavitations, where the bone does not heal correctly, and you have areas of dead bone in the jaw. Now, it's not going to show up on a regular X-ray, but it will show up in a CAT scan or 3D X-ray. So what happens is now these extractions are done because preventatively, proactively, because we don't want them to have a problem later. You've now created a problem because now this bone is not properly healing. And then now all of a sudden, years forward, a couple of years later, now this person is starting to have physical symptoms. They're having, brain fog, joint pains, all these other medical, and they go from doctor to doctor to doctor. Nobody can find what's wrong with them. Now they start saying, oh, these people they're hypochondriacs. There's one of these kooks. They're just drug-seeking people. But in actuality, in those areas of dead bone are bacteria and parasites, fungi, viruses. You can have a cavitation surgery where they go in those sites, they open it back up, and it's like, you ever see chicken fat? That's what it almost looks like. It's like, the top of it is like regular bone, and then you have to open that up, and you can see all this dead bone in there. And what happens is we would go in there, we clean it out, use ozone water, ozone gas, PRF, which is using your body's own blood clot. We take some of your own sample of your own blood, put it in a centrifuge, spin it around with no preservatives and nothing. We take that clot, which has our body's glue in it, and it has our body's own stem cells, has its body's own growth factor. So I'm using my own good stuff. I'm sticking it back in there, and I'm using ozone, which is going to improve the amount of stem cells, of my own body stem cells. It's going to increase the amount of fibrin, which is my body's glue. So I'm using that with that fibrin. And now all of a sudden, once that's all done, patients' symptoms are now resolving. Patients are now feeling much better. So what's happening is you're doing these extractions of these teeth that are not causing any problems and creating a problem. Also, depending on the situation, if, like, for example, a situation with my son, the way his one wisdom tooth was laying, it was eating away his good, healthy tooth because it was laying in it, and it was like trying to grow into his good, healthy tooth. And it was causing a big divot in it. So I'm like, okay, he's going to lose that too. So we wound up having to remove it because it was damaging the other tooth. But if it's not damaging, I would second guess whether you really need them out or not, because they're there for a reason. But the reason why sometimes these third molars are not coming in correctly is because we are damaged, genetically damaged, generationally damaged because of the foods that we eat. I don't know if anybody has ever read this book. Okay. It's by Weston Price. Weston Price, Nutrition and Physical Degeneration. This is a dentist. You can see it's a little light reading. It's a little thick, but he did a study where he went to these colonies that were, they were not tainted by Western medicine, Western foods and all that. And he found that they had beautifully formed jaws. Wide, teeth were perfectly straight. Everything came in the way. Beautiful. No decay, nothing. And he'd studied, and he was like, it's their diet. It's their whole foods. raw milk, grass-fed beef, all these things that we're not using here is what's causing decay and malformation. So now our jaws are much smaller. Teeth are coming in crooked. When people have misalignment, people have impacted molars. So what's happening is because we're generationally damaged from our parents, grandparents, and great-grandparents, because it's passed down, because of the foods, and that's what causes the problem. So how do we fix that now? So when we want to try to grow, so it goes back to what you were talking about, orthotropics and orthodontics, which, that's a lot to unpack there too. About, do we start ripping out teeth and start putting braces on to reform the jaws, and we're making things even smaller? 6-Foot Tiger, 3-Foot Cage. Dr. Felix Liao wrote a very great book, 6-Foot Tiger, 3-Foot Cage, which I think I have. It's not over here. I have it upstairs. Yeah. Talking about the tongue is not sitting in the mouth correctly because we've now made everything smaller by pulling everything out.
Yeah, it really is just a case of a downward spiral of intervention causing problem, causing intervention, causing problem. And it's really not that difficult to see for anyone with eyes to see. Like you just said, who are seen to have the best teeth? African tribes. They have fantastic teeth, even though they have no modern healthcare. They're living more naturally. They're living more along the way that our bodies were designed to exist. Who has the worst teeth? Who are known to have the worst teeth? The English.
Yeah.
You could say the pioneers of the modern Western world and the modern Western living. They are known to have the worst teeth.
Yep.
And then obviously the people are in different spectrums along the way. But, America is kind of a mix ourselves of more indigenous, like immigrants, and then more American, European, this, that. So we have anywhere in between. But yeah, it's so insane how people just think that our bodies are fundamentally flawed in that, oh yeah, we're just born and we have teeth and they decay, and oh yeah, people are designed and our teeth just don't fit. Oh, oops. Are you dumb?
No.
One, are you dumb? But two, do you not give God his appropriate glory? Do you think a God would design people that our mouth can't fit itself?
Right.
That's disgraceful. It's
we
disgraceful.
Damaged ourselves.
It's disgraceful to think that. It's disgraceful to yourself, and it's disgraceful for anyone to believe in God and think that he would design people whose teeth can't fit in their mouth. You're just an idiot.
And what has happened is people, out of their greed, we're talking about corporate giants, Monsanto and, the plethora of other companies, of their corporate greed have created these foods that become addictive. So now generationally, we have now eating these easy to purchase, nutrient deficient foods that's now narrowing our jaws and is creating all these issues. So now dentists, have all these decay they can fill and all these teeth they can yank out. Orthodontists can, realign, but it's all, we've created that.
Yeah, and it's all fallacy. It's all farcical, and it all just sends people down the line of more intervention, more intervention. But let's get to actionables, right? So for anyone here, I'll even speak on actionables. Shut your mouth, breathe through your nose, and make your kids do so as well.
Mouth tape.
Mouth tape, there you go. Ideally, you don't have immune systems that have been damaged so that a child will more naturally breathe through their nose instead of having like issues and in their lungs and whatever. That's a whole other conversation. Keep your tongue at the top of your mouth. Apply some slight to moderate pressure when your tongue is in a resting position. And again, that resting position should at all times be upon the palate because that stimulates the bone structure to develop and the jaw structure to develop. Those are immediate actionables because you can, it's obviously most effective in children, but even in adults that take the practices seriously, you can promote the jaw development at later ages as well.
Bone broth. If you're doing that, I know it's becoming very popular now, mewing. If you are pushing your tongue on the top of your palate. Taking bone broth also, because if you are going to get any kind of movement, which it's going to be hard because sometimes you do need intervention, and that would be like Dr. Felix Liao. He helps row the jaw, but you must. Part of his prescription, you must be taking bone broth every day, because as you're growing that jaw by pushing things open, you want your body to replace it. So, but if you're mooing, if you're doing that, not a bad idea to use bone broth also. How much movement are you going to get? I don't know. It really depends on every case, but big proponent of it. Absolutely. Yeah. And thank you for bringing that up.
Yeah, absolutely. Mewing is certainly growing traction. It has a funny kind of cult-like following, a lot of funny memes out of it. But yeah, it's real stuff. It's crazy how some of the transformations or alleged transformations. But yeah, bone broth to give the body the resources it needs, and that's with anything. When you are trying to heal or improve things, the body needs the resources to kind of allot to it. So you want to make sure you're giving it everything. But yeah, on the wisdom teeth thing, before we get too far off that, not only is it connected to the heart center, and it might be a lot of issues with people's hearts in, on an emotional or physical side that come from the unnecessary pulling of them. But I want to talk about it because it's something near and dear to my heart, how the jaw is actually very connected to the pelvis. And this is something that I've only recently started to dive into because I have a particular reason to. But I've read and observed and seen scientific explanation of how the jaw is very connected to the pelvis. And so at a basic level, when teeth are removed or teeth are misaligned through natural misalignment from lack of being encouraged to grow, but also from orthodontic intervention from the braces pulling everything where they shouldn't be. Now, when the teeth aren't lining up or aren't there and aren't present, those nerve lines are still there. Those nerve lines that are supposed to be connected to those wisdom teeth and receiving sensation of, okay, our mouth is closed and aligned, they're not receiving the proper signal. And so when our teeth are not connecting top to bottom or are not there to even connect, then it sends a kind of short circuit through the brain, and then that goes to the pelvis. And so a lot of people have pelvic problems these days, whether they know it or not, whether they're consciously aware of their symptoms or are experiencing their symptoms and don't even know. A lot of people have pelvic tension, and that's a whole other thing to unpack and the ramifications of that to extreme degrees. But like I'm saying, when the teeth aren't there for the body to recognize, it sends a tension to the whole system that is connected to and contributes to the pelvic tension, which manifests itself in different ways in men and women. And so it just really highlights how absolutely important every element of health is, because nothing exists in a vacuum in the body. If you're getting one area wrong or have one area that's damaged or needs addressing, you're going to see or experience problems in other areas. Like I said, whether you realize it or not.
Exactly. And you touched on something that I was emphasizing tremendously this morning, in that they talk about the oral systemic link. That makes me nuts. That is such a misnomer. There is no such thing as an oral systemic link, because the mouth is attached to the body. The mouth is a part of the body. It's not linked to the body. It is the body. My son's an ICU nurse. When he was in school, he came home one day and he's like, "Ma, I had such a great class today. It's amazing." He goes, "It's just the body is such a magical, beautiful thing." He said that every cell in the body knows exactly what it's supposed to do, because it has DNA coding that it tells it, the cell, how it's supposed to function. So these cells get together and they work together to create an organ. So now the organ of the body knows what it's supposed to do. And then you have other organs. So what happens is the organs all work together synergistically, different parts of the body, to make the body the most magical thing that it is. And when you think of it that way, and I'm like, he gets it. So when you think of it like that, and we're unfortunately for decades, we tend to look at the mouth as a total separate entity, because you have a doctor and you have a dentist. It's like the mouth is separate. How is it separate? Like, what when you go to the dentist, oh, here's my mouth, you fix it, and I'll come back after I go pick up my laundry. No, it's part of the body. So when something's going on in the mouth, it can affect the body, and vice versa. And like you were saying, when it affects pelvic issues, if your teeth are not coming together correctly because of these generational issues, crowding or misalignment, and your teeth are not meeting correctly, that will just throw your whole skeletal off. Like, you can have one shoulder lower than another, or if you're not breathing correctly because of the alignment of your teeth, you're now more stooped forward. You now have that forward head and you have the humped back. And you are going to, so we have patients that we will have them stand up against the wall with a chart on the side, and we take a picture, and we can see how the way they're standing. And then we do the therapy to help grow the jaw. And then we take the pictures again. It's like a totally different person. And people who are having problems with their pelvis or legs, and the teeth are not coming correctly together, you can use a particular appliance. You put that appliance in, and now all of a sudden that patient is now, their pelvis is aligned. They can walk straight. And he said, what the heck is my mouth got to do with that? It's all one. It's all part of the skeleton. The jaw is part of the skull, which is part of the cerebral is part of the spine, which is part of the rest of the spine, which is part of the rest of the body.
Yeah.
And how we treat it separately. It's not.
Yeah. For years, I've had a pelvic injury, a strain, and it, clustered into a whole bunch of stuff. And for those same years, I would grind my teeth with intensity at night. With intensity, I was mangling the mouth guards. I was mangling my teeth. My teeth are actually ground completely flat, which is kind of aesthetically nice, but it's obviously not supposed to be like that. From all the grinding, and I'd be waking up with like pain and tension, and like I could feel all the damage I was doing. And as I've been working with my wonderful clinical shiatsu specialist to heal the body from all angles, we work on my jaw to reset it. We work on the pelvis to fix everything that's going on there.
Yep.
And I no longer grind my teeth from working on the pelvis.
Absolutely. So a night guard is great for an immediate issue, but it's only a Band-Aid, like you said.
Yeah.
It's a Band-Aid. Fixing the cause of it. It could be pelvic issues that are causing it. Could be airway issues that are causing it. You have a narrowed airway. Could be parasites. Somebody can be infected with parasites causing grinding. Dr. Simon Yu is an amazing doctor. Talks about parasitic infections and dental issues. Dr. Dawn Ewing, she talks about it also. She does EAV testing and talks about parasites. So there's so much information about the involvement in the mouth and the body. And we still, they say, oh, you're crazy. No, how is the mouth not part of the body? And, you can see clues if you know what you're looking for. And not everybody knows what they're looking for.
And it's such an essential part that gets ignored so much because it's our first point of interaction for our food. It's how we talk. It's such a central and core element of humanity, and it just gets kind of brushed aside and really ignored. It's ridiculous. But I have a question to kind of backtrack a little while. We mentioned the OG cavity filler, gold. Do you have any thoughts on that? Because I've seen schools of thought that gold is actually wonderful to have in the body and has all these effects. And gold has obviously been renowned all throughout time. It's been known spiritually or it's been said it's from another realm and it has all these benefits to have in the body. I've also seen that gold can be damaging in the body, especially for men. It could affect testosterone negatively, different things. Do you have any thoughts on is gold a good to fill cavities with?
In my world, if you are going to insist on having a metal filling, gold would be the best. But The caveat is gold itself is too soft. It needs to be mixed with other metals to make it hard enough. That's why you have like 14 karat gold, 18 karat, 24 karat gold, right? So the higher the carats, the more gold and less of the filler metals. So to withstand chewing forces, that gold needs to be strong. So there's a lot of filler metals in there. I'm going to say most, if not all, biological offices, we use zero metal, none, no metal whatsoever. Minimally two reasons. First of all, because of those other metals that are in there, palladium, cadmium, nickel, gosh knows what's in there. I don't even know what's in it, but it could be any of those metals. And people can be reactive to those metals. Oftentimes, like I was talking about that reactivity testing earlier, we get patients that are coming back that they're allergic to, palladium, cadmium, and, the nickel and all that. So they're going to have reactivities to those metals. It's going to cause an underlying inflammatory response in the body. So that we don't like to use metals because patients can be reactive to it. Maybe not necessarily the gold. And then you're going to find patients who are reactive to gold too, because not everybody fits the mold. More importantly, it blocks the meridians. Metals block the meridians. We were talking about the energetic pathways before. When you have energetic pathways, the tooth organ pathways, if you go to Google or DuckDuckGo, doesn't matter what search engine you use, look up tooth organ meridians and you'll be able to see a chart. And what will happen is you'll see what teeth are connected to what organs. And if you happen to have a metal filling in a particular tooth and it's connected to an organ, and you're like, oh, wow, I've been having problems with that for the longest time. The doctor could never find why. Well, could it be because that metal filling is blocking that meridian? It's just like if I'm trying to block my lamp over here, and I have a piece of tinfoil covering the electric outlet on my wall. And I'm trying to plug my lamp in, and I can't plug it in because I have a piece of metal or a piece of aluminum foil covering the electric socket. I can't get a connection. Once I remove that metal aluminum filling or that metal plate, I can now get it. Now it's working. My lamp works beautifully now. Couldn't before. So we don't look at the metal potentially being an issue when it comes to meridians, because you want that chi to flow. You want the meridians to be open. The healthier the chi is, it's overall health. I mean, I'm not going to get into Chinese medicine. That would be for somebody else to get into. But that is something I highly believe in. So if it's your only choice, again, like I said before, what's the lesser of two evils, risk reward? I would take a gold filling over amalgam any day. But if I can avoid it, I'm going to avoid it 100% because I could potentially be reactive to the other metals that are with it. And more importantly, it's going to block a meridian.
I wonder if all these rappers, when they're getting their grills, they test themselves first.
I'm sure they do. I'm sure they do. I'm sure it's the aesthetic that's more important now. No, it's image we have to portray.
Yeah, it is pretty gangster. It is pretty.
Yeah. So I don't mind it. I mean, everybody's individual. I'm not going to force my beliefs on anybody. Right? So you do whatever makes you happy. I can only impart information, and everybody is happy with what they believe in, because I could be saying things that you resonate with some of it, and some of it you're like, okay, she's nuts, or you don't resonate with any of it. And that's totally okay, because that's why we have that free thought. Okay. That's what makes us humans. We have the ability to think, we have free choice, freedom to believe what we believe. And, I could just put information out there based on, not junk science, but, good science.
Damn. So we won't see Fran with any diamonds in her teeth anytime soon, which is unfortunate. But we have a couple minutes, and I do have a couple minutes to run overtime if you want to, give the due explanation. But to close up, can you just talk about the IABDM? What is the IABDM?
Sure.
What's your role in it? Why would people want to, look at their website or check them out?
Sure. The IABDM, like I said earlier, is the International Academy of Biological Dentistry and Medicine, with a bit of a mouthful. And the key word is biological medicine, biological dentistry and medicine. Because when I talk about biological medicine, which is founded in Germany, talks about the terrain theory and the body's ability to self-regulate, when you go back to the body's ability to heal cavities or body's ability to heal itself, that's what biological medicine is. We're a big believer in energy medicine, homeopathy. Of course, we want to avoid toxins and stuff, but we want to support the body's ability to heal itself using things like colloidal silver. I'm not going to use an antibiotic. I'm going to use colloidal silver. I'm enhancing my body's ability to heal using things like probiotics. I don't want to nuke all the bugs in my mouth because I need to keep a balance. There has to be a homeostasis. So if I can introduce more good bacteria, eating more prebiotic foods that are going to feed the good bacteria, so I'm going to have a balance and be able to have my body to self-regulate. That's what biological dentistry is, and along with avoiding toxicity. So a lot of times, if someone is just looking to have an amalgam removed, I want to have safe amalgam removal. They can find a dentist that just does safe amalgam removal, but they don't look at the medical history, malabsorption issues, new micronutrient deficiencies. They're not looking at methylation pathways. They're not looking at using antioxidants to support micronutrient deficiencies. The patient's got an abundance of free radicals causing oxidative stress in the body, which is going to affect the immune system. So, do we use antioxidants as part of the treatment modalities? Do we work with naturopaths? We work with integrative physicians. We work with functional medical doctors for the patient's behalf, meaning it's not just I'm going to treat your teeth and then bye-bye. No, a lot of times we are working synergistically with a medical practitioner, like these integrative practitioners. And I'm not going to call them alternative. There's nothing alternative about clean water, exercising, sleeping right, eating clean food. It's ridiculous. They call us the alternative when actually the alternative is putting that crap, those chemicals, those poisons, those prescriptions in your body. That's the alternative, not the healthy stuff. Okay, I'm sorry. So that's what biological dentistry is. So that's what we stand for. So as a patient, if you want to find a dentist that practices this way, you go to the IABDM.org and you put in your state, and you can find a dentist who is a member that believes in this whole paradigm. And now, again, everybody's on a different place in their journey. Some people can be just starting out, just becoming aware. They've just awoken from their slumber, and they're now starting to practice this way. Or you have had doctors that have been practicing for a couple of decades this way. They were one of the OGs where they were practicing when everybody thought they were cuckoo. And so here's where you would find your practitioner. And the same thing with the IAOMT. You would find practitioners there also. Their paradigm is, mercury removal, mercury safety, fluoride safety. But a lot of our members for the IABDM are also members of the IAOMT. And they practice differently. Some will practice more biologically, some not so much. But again, depending on what your needs are is where you're going to be able to find. And that's why if you find a doctor, call and ask questions. You want them to be in alignment with what you're looking for, and they fits the needs of what you need. If you are a dental practitioner, a dentist, hygienist, assistant, again, either organization, please reach out to either organization, IAOMT or the IABDM. We're happy to guide you in where you can find more information, where you can learn more. Just by becoming a member and networking with other practitioners, you get to learn more that way. So we need practitioners that want to deliver this astounding healthcare to a patient, and we want to serve our patients, because basically it's the patients that are driving the need for more practitioners. Patients are driving the need because they don't want the simple solution, the drill fill bill. I don't want just Band-Aids. I want to find root causes of a disease. I want to address it in a way that is least invasive, more compatible to my body. So patients are pushing back. Patients are going to the dental. I don't want amalgam fillings. I do not want fluoride. Like you said earlier, somebody said, I don't want fluoride. The practitioner probably rolled their eyes and said, oh, one of them nuts. And they gave it to them anyway. That's assault. No, you have freedom of choice. So we need more practitioners to be able to give the options to these patients that request something that is going to be effective, but is going to be compatible. So that's how you would reach the IABDM and IOMT. What I do with the IABDM is, as the associate director, I assist the executive director in creating paradigms, SOPs, standard operating procedures. We put together courses and conferences so that way more biological practitioners can learn more to be able to serve their patients more. How I started is they just saw my passion and how hard I believed in it. I worked for a doctor, and I don't want to start crying. I worked for a doctor for 10 years. And when I started working there, I was so super excited because I had believed in this way from back in the 80s. But I never knew that there was a thing. I never knew that it was a thing. So I started working for him. And he saw my passion for it. And he fed my passion. He nurtured me. He mentored me. He allowed me to grow. I'm going to start crying. He allowed me to grow to who I am today, where this organization recognized it. And I didn't look for this position. They came to me. They said, Fran, we want you to be part of the leaders in the organization because we see how much you want to make a difference. And that is innately me. But I was nurtured by somebody who's also so passionate about it, who's also accredited by the IAOMT and certified by the IABDM. He got all his training from the organization, learned how to be able to properly treat patients' disease and not just a simple slap a filling in and send them on their way and send them a bill. And I am honored beyond belief to be involved in this organization because when I was a clinical dental hygienist, I just 2 days ago, I celebrated my 40th year of licensure. Yeah, I'm old. So 40 years of licensure as a dental hygienist. I could help one patient at a time when I would treat them. Here, as part of the administrative staff of this organization, and I train, I lecture, how many more people can I help? And that just feeds my soul. How many people I could potentially help by, doing something like this podcast or doing like a lecture I did this morning and like the lecture I'm going to be doing next weekend. And that fulfills my soul because we're all one, okay? Energetically, we're all connected. And if I can't help another human being by helping them learn a way of being healthier in a less toxic environment and using the body's innate abilities, then shame on me. I also lecture for the IAOMT. I'm lecturing for them in March. I'm giving them 2 lectures. So, the IABDM and the IAOMT are sister organizations. Even though there's some slight differences between the two, the mission is the same: to help people live a non-toxic life, help them have dental issues addressed that other conventional dental offices are not recognizing or addressing, or actually thinking that we're crazy. It's about the mission, about helping people, and I find that at my age, I am so blessed to be able to do that, to for whatever degree that is. So helping patients, helping doctors get to be able to know how to help their patients is what I'm here for. So
That's beautiful. That's beautiful.
Yeah.
I mean, your passion, it absolutely exudes through the screen for anyone just listening. I'm sure it'll absolutely exude through your voice and the audio as well. And if that man that you were mentioning was the one who kind of brought you to where you are, if that's the man whose office I visited in New Jersey, then I absolutely agree that that man is a wonderful, wonderful man, a wealth of knowledge. I have had the experience. He was my first experience of biological dentistry and holistic dentistry, even at that. And the office that he's created is a wonderful place that I was honored to visit, and that treated us with the utmost of compassion and
Yeah.
integrity and quality of care that I think could be the gold standard of dentistry as a whole and as an industry.
Agreed.
His materials are, and his voice, and he's just, you could feel that he has a desire, just like yourself, to bring health to people. But we have a few minutes here. Fran, are you someone that people can or should get in contact with directly for anything? Why would
Sure.
someone contact you directly, and how would they do that?
Oh, absolutely. If like you have any questions about more questions about what biological dentistry is, whether it be as a coming from a patient or a practitioner, you can always reach me at associate.director at IAB like boy, D like David, M like Mary.org. Associate.director at IABDM.org. Or you can call the IABDM at 832 770 7584. You can call or text that number if you want more resources of what you can, find practitioners, or as a practitioner, where you can find resources to learn more about biological dentistry. More than happy to help. Because again, the more information I give you, you can help your patients. I feel like my hand is in there too, right? Every time you touch that patient, I feel like I've helped there. And that's not a selfish or an ego thing. I swear it's not. It's because I feel restricted by only helping one patient. And it feeds my soul to be able to help as many people before I leave this earth. I want to help as many people as I humanly can within the capacity I can. So I'm very open to helping as many people get the information that they need in this type of approach, for sure.
Amazing, amazing. Fran, is there any particular message you'd like to close off with to leave our listeners and viewers with?
Yes, that anything that I may mention to you, I'm sure it's going to resonate with a lot of your listeners because they're listening to you for a reason. So a lot of it's going to resonate. Everything that you hear me talk about, I want you to have an open mind and know that sometimes there isn't a definitive answer. There's not necessarily the research behind it or the science yet, because we only use a small portion of our brain. There is a lot of information out there that is misleading. A lot of information out there is trying to divert you from the truth. I want you to critically think about anything, whether what I'm talking about or whatever Zach brings to the table. Have that critical thinking, what resonates with you, because you'll know what is right for you. And living a life of purpose, living a life of doing the right thing and for yourself and for those around you, for your family, your friends. And part of that is like with biological dentistry, medicine is holistic, the mind, body, spirit. So having that spirit of that we're as one, and knowing that it's more than just teeth, it's more than just the physical. It has to do with having an open mind to be able to critically think and accept any of these outside thoughts or alternative thoughts, and know that we don't always have the answer to everything. And the fact that you're open-minded enough to sit here and listen to what we're talking about and the other topics that Zach is going to bring to you is you're enhancing your life. And when your life is enhanced, so are the ones around you. And then they're influenced, and then they will influence those around them. So everything that we talk about, believe it or not, is a pebble in a pond. Everything that dropped that pebble, then you have those rings that come around it. So yeah, we're talking about teeth today. We're talking about cavitations, but again, it's a philosophy and action of there's answers that we don't always have the answers to, but answers, meaning like research and all that, but we have answers that other practitioners don't. And being able to really take a deep dive and exploring, asking more questions, like you, Zach, you're doing more of a deep dive and looking for more information on, the pelvic issues. So being open, just being open and having things resonate and asking questions. Don't take things for face value.
It's time for people to start using their actual intelligence, start using their actual intuition, and stop being a bunch of nerds.
Right. Or sheep, just following whatever I'm told. Okay, that's what it is. No. My father, I'm just going one last thing. Oh my God. My father, God bless rest his soul. He passed away at 92 years ago. It's a generation. He passed away like 10 years ago. So it's a generational thing. He had to go to the doctor. He took himself to the doctor. So he came home. So I called him. I said, Dad, what did the doctor say? Oh, I don't know. He said, he gave me a prescription. I said, well, what is it for? He goes, oh, I don't know. I said, what do you mean you don't know? When you put it, oh, I don't know. He's the doctor. He told me what I'm supposed to do, so I'm just going to listen to him. What?
There's too much of that, and we could certainly get into why.
Don't do that.
Society has developed into that
that mentality. Because you're a doctor.
Yeah, I call it expert worship.
No.
And there's too much of that. But I do have to go, Fran.
Of course.
And thank you very much for coming on the show. I look forward to our future conversations. I think we could probably have a part 2, 3, and 4. So I'm sure that will come. But for now, it's time for us to go. Thank you.
Enjoy. And be well.
Most people hate the dentist, and for good reason. Unfortunately, the average dentist has no idea how the mouth works, let alone how the body works as a whole. And that's why a lot of people's experiences with dentists are so unfortunate. This is one of those areas that's super essential and is an easy actionable for people to implement into their day-to-day life. Next time you need to go to a dentist or feel you need to go to a dentist, go to the organizations that Fran has mentioned and find a dentist. Maybe you'll have to drive a little more. Maybe you'll have to go outside of your town. Maybe, it might cost a little more, insurance, this, that, whatever. But it's such an easy thing to just go to a different dentist and get real healthcare. Real healthcare. We're not talking about alternative healthcare. We are talking about real caring for your health instead of just drilling, filling, and billing. It's wonderful to continue to learn about offices such as the one that Fran worked at and the one that I attended and all of the wonderful offices and practitioners out there that are using real ancient wisdom to keep you healthy in the modern world. So thank you very much to Fran for coming on the show. I really hope you enjoyed and paid attention to this episode. Watch it back. I'm sure you'll continue to pick up a thing or two. As always, please show your support by liking this video, subscribing on whatever platform you're listening on. You can go to ZachTheHealthKing.com to check out all the platforms that I'm on. Check out my social medias. Please send links around, share it with your friends. There's a lot of people that could use this good information. And stay tuned for more episodes. I'm Zach the Health King. You're listening to the Health King's Court. Ancient wisdom, modern health. Are you dumb?